The second wave has ravaged India. Cases are rising, deaths are increasing, and the attention of the media and the administration is on urban India. In such a condition, it is very easy to neglect what is happening in rural India or poorer states, which, by the way, constitute nearly 65% of the country's total population. As we battle the second wave, the focus is only and only on one thing: vaccination. Experts say that India may take more than 3 years to complete the required number of vaccinations to attain herd immunity against coronavirus. Shortage of vaccines, logistical barriers, wastage of doses can further delay the entire vaccination process. But there is another crucial factor that could pose a serious challenge in India's COVID vaccination drive: the new vaccination policy introduced by the government. Experts have warned that the new vaccination policy requires states to procure vaccines directly from manufacturers to vaccinate the adult population, which is between the age group of 18 to 44 years. This is likely to affect poorer states. How? Allow me to explain. The government introduced a plan where states and private hospitals will share the burden of vaccinating the adult population. The government will procure 50% of COVID vaccines from manufacturers, including Serum Institute of India and Bharat Biotech, at a discounted rate of 150 rupees per dose. These vaccines will be given free of cost to states on quota-based criteria, but will only be used for vaccinating health workers, frontline workers, and adult age group. What happens to the remaining 50% vaccine doses? Well, that will be sold to states, private hospitals, and companies at a rate decided by the manufacturers. As of now, states are paying 300 rupees per dose to procure Serum Institute's Covishield and 400 rupees for Bharat Biotech's Covaxin. These rates are at least double the price to procure vaccines in comparison to the central government. For private hospitals, the cost of procuring vaccines is even higher, and the final price includes GST, transportation, and storage charges, which means the final price becomes unaffordable for poorer states. Reports suggest that the cost of getting COVID vaccines in the country's private hospitals is the highest in the world. This means a large chunk of India's population from the adult age group will opt for vaccination programs conducted by the states, which are either cheaper or free, because incomes have also taken a major hit during the pandemic. More than 20 states have announced free vaccinations, but all of them are struggling to get enough doses amid an alarming shortage. Getting vaccines is a massive challenge for poorer states that have low per capita health spending. States like Uttar Pradesh, Bihar, Madhya Pradesh, Assam, Rajasthan, Jharkhand, Chhattisgarh, and so many more are facing delays in vaccinating people in the 18 to 44 age group. These are the states that have low healthcare spending and a larger share of poorer people. Many of these states would need to spend nearly 30% of their total allocated health budget to just vaccinate the adult age group. And remember, what we're talking about is just the cost of procuring vaccines. The complete vaccination process is likely to cost much higher. Even if these states plan to vaccinate a majority of the population for free, it is very uncertain that the process will be completed within 1 year. Now, here is where the role of the central government comes to ramp up the vaccination process across the country. The centre has received criticism for just using a part of the 35,000 crore rupees that it allocated in the budget for vaccines. The PM Cares Fund has also come under the scanner at a time when the country is unable to vaccinate its citizens. At present, less than 15% of the total population of the country has been vaccinated. Based on this experience of over 100 days of vaccination, experts have said that India is in for a long haul. India, which is a young country, has more than 50% of total population above the age of 25. This means states will have to bear a bigger cost for vaccinations. While much of urban India has made it to the headlines, there is an urgent need to fix the disparity in healthcare services in rural India. If urban India, with its public and private healthcare facilities, can see its medical infrastructure collapse, one can only imagine the plight of the ill-equipped rural India. As experts say, mass vaccination is the only way to fight the virus. The focus has to be on two things: overcome vaccine hesitancy and boost availability and equal distribution of vaccines. Ramping up medical infrastructure, increased awareness, and a rapid vaccination program can help reduce the impact of a major medical disaster in rural India.